to do today. Okay, so you guys did well on your homework, but you probably heard two different comments from me on your homework depending on how you did it. Some people gave a very generalized overview of spinal erectors, which I actually thought was excellent because we kind of have to know about them in general. But then I probably wrote something like, you need to be more specific about attachments because we got to find these muscles eventually. And you were like, okay. And then those of you who were very specific about attachments, I probably wrote something like, my God, isn't this confusing? Because it is. So today we are going to try to clear up some of the confusions, try to simplify some of these attachments for spinal erectors, try to explain why they're so confusing, and we're going to try to talk about back muscles in general. There's lots and lots of groups of back muscles coming at you live here very soon, and I wanted to kind of do just a general overview of a coming of special attractions, so that we have that too. So let me share with you here. Actually, before I share with you, let me explain to you the problem with back muscles and why they're so confusing. If this is your back, things like your spinalis, longosimus, and iliocostalis are not really one muscle. But it behooves us to talk about them as though they're one muscle. So let me give you an example. The spinalis actually attaches to the spinous processes of your vertebrae. But it's not really one long muscle like this. It's actually little muscles that attach from various spinous processes. Well, when you attach a whole bunch of muscles from various spinous processes, you get something that looks a little bit like a tree, right? And when we go talk about trees, we just say, hey, there's a tree standing up over there. We don't say, there's a branch, there's a branch, there's a branch, there's a branch, there's a... And so when they're giving you these attachments, they're kind of talking about it like, here's the branch in the cervical region, But the fact is, as massage therapists, again, it's like, well, we don't care. We don't feel every single little fiber and know that one's separate. We care about the spinalis, which is a group of muscles, really, that we call the spinalis. And the longosimus, which is a group of branches that we call the longosimus, that all run together and overlap, and so it's very legitimate to call it that. But that's where you're getting this weird stuff from. So I will try to give you a simpler way of looking at the attachments of the spinal erectors. The other thing is origins and insertions become very confusing on spinal erectors, right? Because honestly, if I do a back bend, is my head getting closer to my butt or is my butt getting closer to my head? It really depends on how I'm doing my back bend. And so I don't even like talking about it like that. I like talking about it like attachments. The fact is there's stuff hooked here and there's stuff hooked here, and when they contract, they get closer together. So we will try to avoid terms like origin insertion when it comes to these spinal erectors because it confuses the issue. And I'm not trying to make the material simpler for you. I mean, I am, but that's not the point. We're not trying to water down the material. We're actually trying to understand it better because there's nobody in this room, including myself, that can memorize like, oh, it goes to this L4 and L5, but not on a Tuesday. And then sometimes, it just gets ridiculous. So that's what we're going to attempt to do is take what your book says, which is very technically true, and say, what are they really saying with all this junk? And how do we say it simpler? So let me share my thing, and let's see if we can't do that. That would make me very happy, and hopefully you too. Okay, spine and thorax. Boom. So we're going to have to start getting very cognizant of layers of back muscles. So we have studied some of these more top layers. We've studied the latissimus dorsi. We've studied the trapezius. We've studied the rhomboids, which are underneath the trapezius on the right there. And we've studied a lot of the rotator cuff muscles and things like that, which are kind of underneath the trapezius and underneath the deltoids and things like that. We are going deeper than that. And by the way, do you guys see the thoracolumbar aponeurosis here? The white thoracolumbar aponeurosis here? Notice how, by the way, the back muscles weave into it, and it weaves into your sacrum, and your glutes weave into it too. Glutes And thoracolumbar aponeurosis and spinal erectors or erector spinae muscles are very intimately wound when it comes to back problems. I don't ever think about a low back problem without thinking about somebody's glutes. Ever. Ever. They're very intimately related, fascially related. And as a general rule of thumb, you wouldn't follow it 100% of the time, but as a general rule of thumb, 98% of the time, you'd always work glutes if you're trying to loosen up somebody's low back. Always. Okay. We are going to go much deeper to some of these back muscles, the spinalis, longosimus, and iliocostalis. And it's hard to tell from this picture, but you can kind of see how there's little like strips of muscle that make up things like the longosimus and the iliocostalis. There's little strips, and that's what they're talking about origin insertions of each part of these strips. But we're going to talk about the entire muscle to make life a little bit easier on us. So let's do that. Let's go on to, bear with me. We will come back to all this because it's going to be very important. But let's talk about the Erector Spinae group, which main job is to keep you erect, to keep you upright. That is its job. And so if both sides pull bilaterally, it causes an extension of my spine. I'm using these muscles right now to gently extend while my rectus abdominis is gently flexing to keep me upright. My back muscles are pulling back, my rectus abdominis is pulling forward. I'm oversimplifying, but I'm basically doing this in microscopic terms all the time in order to stand upright. So you're using these muscles all the time. All right, let's take a look at them. All right, so here's the Erector Spinae group. Oh, they got a picture of a tree, good. All right, so here's the Erector Spinae group, because this is kind of my point. We are only seeing one side of it, but we are seeing the spinalis, the longosimus, and the iliocostalis. Now, many people, not massage therapists by the way, thank God, many people when they refer to these muscles will talk about the cervical spinalis, or the thoracic spinalis, or the lumbar spinalis. As far as we're concerned, it's all the same spinalis, but the reason they do that is if you can look at this slide, you can actually see that there are individual muscles tying the spinous processes together in the thoracic region, and then there are individual ones doing it in the cervical region. And so that's how they talk about these tree branches. But if we look at them all together, they look like a tree. And we are talking about the entire spinalis. We kind of want to know where that tree starts and stops, not where all the individual branches start and stop. If we go out a little bit more laterally, you will see the longosimus here. I can tell it's the longosimus because it's going up right behind this person's ears to the mastoid process of the temporal bone. Anybody else think of another muscle that attaches to the mastoid process of the temporal bone?
SNC, Sternocleidomastoid. The letters are wrong, but you know.
Yeah, Sternocleidomastoid, good job. SCM, Sternocleidomastoid, yes, it goes there and attaches in front. The longosimus attaches behind. That's very important later, we're going to find out. So the longosimus, if we had to pick a favorite back muscle, it's our favorite back muscle because it tends to have a lot of structural importance. They all do, by the way. But if we go out further, we see the iliocostalis, and it literally is attached to the ilium and your costals, your ribs. It does not go all the way to the top. It actually swings way out to the side and comes back in. And why do we have so many of these back muscles? Because it's very hard keeping a spine erect. It really is a stack of dominoes. Stacking two of these on top of each other is fine. Put 24 on top of each other, and you've got a big problem of how do we keep this thing stable and how do we move it around. And you need lots of muscles to do that. So these guys do the heavy lifting of extension, which is a back bend, which you do all the time, whether you're just trying to stand erect or you bend over to pick up anything. You are extending your back. These are major back extenders. Now, that's if both sides are working. Both sides are working, extend. One side working, lateral flexion, right? We can see that, lateral flexion of my spine. Yeah? Okay. So your book gives all these complicated kind of explanations of the origins and insertions of this. But let's look at a simpler way to look at this. Hold on. I'm sure I put it in here. I hope I put it in here. All right. Bear with me. I will come back to this slide because you'll want it. Here we go. Let's look at this. These are my own notes, and this is a simpler way to look at the attachments of the spinalis. Because really, the spinalis really attaches the spinous processes of C2 to L3. So, what is your first spinous process on your body? It's C2. Remember, there is no C1, right? And it goes C2, C3, C4, C5, C6, C7, T1, T2, T3, T4, T5, T6, T7, all the way down to T12, L1, L2, L3. And by the time it gets down to L3, it's in the thoracolumbar aponeurosis. I mean, you could argue it goes all the way down to L5 because that thoracolumbar aponeurosis is woven in here. But that's it. So I took something that was very complicated, all the stuff they had, and I just said it attaches all the spinous processes of C2 to L3 and the thoracolumbar aponeurosis together. Because that's what it does. Now, theirs isn't a single piece of tape. What they did was they said, well, what really happens is it attaches C2 to C4, and then it attaches C4 to C7, and then another one. But the fact is, visually speaking and feeling-wise, when we're rubbing somebody, this feels like one muscle. It's just made up of a whole bunch of little branches. And so when we want to talk about the muscular tree of the spinalis, we could just say it attaches spinous processes of C2 to L3 in the thoracolumbar aponeurosis. That lets us know it runs right down the back on both sides, attaching these spinous processes, and it goes all the way down the thoracolumbar aponeurosis. That's it. Does that make sense? I'm hoping to give you an easier way to look at something that your book made very complicated, I think. Right? And now you basically know when you're running your hand down somebody's back from their neck all the way until you kind of disappear in the feeling of their sacrum, basically, that you are running down the spinalis. It kind of disappears down here around L3 and goes into thoracolumbar aponeurosis, but it's there. Okay? Now, I'm going to talk about the Longosimus in a second, but I actually want to skip it for a second. Yes, Mr. Blygen, please.
While we are running down the spine with our arm or fingers or whatever, should we be more cautious about being around C2, like in the cervical area because of like veins and arteries and stuff, or is it protected by the muscle? All those things.
It's actually, the back of people's necks is actually highly protected. So you don't actually have to worry about pressing in at all. The way the vertebrae lay down on your neck, they actually protect the spinal cord there even more so than some other places in your body. And the only thing you have to worry about in neck is twisting it or bending it fast. But you can press. I mean, really press. Yeah.
Because when I'm like doing like neck work or like massaging the head and I run my like thumbs down the side of the neck, I always feel like I probably shouldn't go too hard here because I don't want to press like arteries or something. But that helps me realize that I can probably do a little bit more.
No, thank you, Mr. Blygen. These are exact questions I want. And yes, essentially, there's a reason that people don't choke people from behind. Right? They might sneak up behind, but they don't actually choke you from back here because it can't be done. The stuff to worry about is up in here. And from the back, I'm often pressing people hard enough that their neck is coming up off the table. Yeah, without thinking twice about it. You can press them as hard as they can comfortably handle it on their back of their neck. No problem. Literally zero contraindication.
Is that where also a lot of tension is being held in that cervical area?
Yes.
Okay.
Yeah, you want to develop actually a massage where you can sit at the head of a table and work somebody kind of like their upper, like when they're supine on their spine, work their upper shoulders and neck and just sit there for an hour. You really want to have something where that eventually becomes something you can do. And I use this in my massage timing a lot. I love to finish on head and neck because I can spend 2 minutes on your head and neck and be very effective. I've got good moves for it, but I can also spend hours on it. Like there's so much to do up here. And so that's when I sit down towards the end of your massage and I kind of put my hands underneath your neck and I look up at the clock. And based on how well I did my timing, you're going to get however many minutes are left of this massage. Yeah.
Okay, one last question, sorry.
No. These are really good.
When we are doing neck work in that area, is it better to keep their head straight, or can we do like turn their head to the side and do the work, or does that complicate things more because of the way that the muscle moves with the head?
You can definitely move their head. That's the quick answer. I would argue that essentially, again, you know me, I'm making generalized statements. There is a reason to violate all these at some point. But in general, anytime you can add massage into your movement into your massage, you should. So not only am I saying, yes, it's okay to move the neck, I'm saying, yes, you should probably try to move the neck. It does complicate things in some ways, sir, but it also moves the muscles around while you're massaging them. And I love to double massage. I love to stretch while I'm massaging. So the neck's going this way, my thumb's going that way. You know what I mean? Stretch while I'm massaging. So I love the concept, what you're talking about. You're running your thumb up there. Well, why not twist the head over while doing this? Mm-hmm. Why not wiggle it around on your thumb and kind of feel those little gaps in there? And like, that's really good stuff. Yes. So I invite you to do that. And again, because it's the back of the neck, you could even play with trying to get your fingers in between the vertebrae. You won't be able to, but you can play with that kind of intricate detail back here and really try to get into stuff and wiggle the head around. As long as you're turning it slow, you can really turn it. You can bend it, turn it, flex it, bop it, whatever. Yeah.
Okay.
Anything else, sir? Those are really good questions. I don't want you to cut them short. And they're directly massage relevant. Really good point. All right, so we talked about the spinalis. And the thing is, I want you guys to realize the spinalis lives right next to the spinous processes, right? It's when you're going down in the lamina groove, it's the guy that's right next to the spinous processes, and it's one of the muscles you're hitting. And it essentially goes from the first spinous process, which happens to be C2 because there is no C1, all the way down into the lumbar area where it disappears in the thoracolumbar aponeurosis. Boom. Now, normally I would talk about the longosimus next because it's the next most lateral, but I want to go really far lateral to make a point and to help you keep these separate from your mind. The iliocostalis is literally named the hip rib muscle, right? And it likes to swing way out to get your hips and ribs. It likes to swing way out to get your hips and ribs. And so what's on the outside of vertebrae? It likes to go to the transverse processes of C4 through C7, connect with all of the ribs, and then down in the posterior, down into the thoracolumbar aponeurosis, down into these transverse processes and down into the hips. Did I put hips on there? I sure hope I did. 3. Yeah, I didn't. But your thoracolumbar aponeurosis goes into your hips. So it is very simple just to realize this guy likes to grab onto transverse processes, ribs, and more transverse processes. L1 through L3. It swings out wide because it is called the iliocostalis. It is called the hip rib muscle. So it hooks into your hips by going in thoracolumbar aponeurosis, and it grabs onto all 12 ribs, and it grabs onto transverse processes at the beginning and the end, in the cervical and the lumbar region, because that's how it curves out. But that's why it's called the hip rib muscle. So you could argue that it grabs on the last couple of transverse processes, C4, C5, C6, C7, grabs onto all the ribs, and then comes swinging back in to grab on the transverse processes of L1, L2, L3, where it kind of peters out, just like the spinalis does here in the thoracolumbar aponeurosis, in this area. It's a much simpler way of looking at it. And it's true. It's not watered down. It's true. Yeah. Yes, please. Please, Mr. Blanchard.
I think Ms. McDowell had her hand up first, too. I don't know if she had her question still.
Ms. McDowell, did you have a question? Thank you, sir.
Yeah, I did. It was just a little one. I forgot what ligamentum nuchae was. I wanted to.
That's not just a little one, that's an important one. Ligamentum nuchae, what does ligaments do?
It's the bone to bone.
Yeah. Ligamentum nuchae attaches your external occipital protuberance, the bump on the back of your head that you can actually feel, to your vertebral prominence, the spinous process of C7. And by the way, it grabs onto all your cervical vertebrae and back. And so here's the problem, everybody. This is a great question, by the way. Here's the problem for everybody. When we say things like ligamentum nuchae, it doesn't just go from here to here, here to here. It attaches to all this stuff on the way down. And so me saying that something attaches to ligamentum nuchae is the same as me saying something attaches to the spinous processes of C2 through C7 because the ligamentum nuchae does. Does that make sense? And so we get this very confusing talk where like these guys that come down here, these spinal erectors, they really do go in the thoracolumbar aponeurosis. But the thoracolumbar aponeurosis really does attach to the spinous processes of this lumbar region. So you can say it in two different ways. I like saying they go down the thoracolumbar aponeurosis because I feel like in real life that's really more of what they do and how it feels to you as a therapist. But the thoracolumbar aponeurosis is woven into your hips, which is why it's part of the Iliocostalis, and it's woven into your spinous processes down here, and that's why we can include it with the spinalis and the Longosimus and all that because it's down here and it's an anchor. So the thoracolumbar aponeurosis is an anchor that lots of stuff hooks to. The ligamentum nuchae is an anchor that lots of stuff hooks to. And so it gets very confusing because you'll look at one book and they'll say, oh, that attaches to spinous processes of C2 through C7, and another one will say it attaches to ligamentum nuchae. They're both saying the same thing. It's just how do they get there? And the really confusing part about this on a real human being is all this is just it's there, and you can find it, but everything's woven in, you know? And so it gets hard to say what's with what. But anyway, ligamentum nuchae is this ligament that's woven between your head and C7, but all the stuff on the way down too. It's part of what gives your head support back here. It just helps hold up its weight. But as you and I both know, things like your trapezius likes to hook into it, and your spinalis likes to hook into it, and you know, because all that stuff starts to become inseparable back there. Mr. Blygen, take it away, sir.
With the Iliocostalis, what's the best way to kind of massage that? Because I'm always worried about going down that part of the body where the ribs are, out of fear of like going too hard and possibly breaking one. I know that you mentioned before that it's not impossible to do, but it's not that easy to do as well. But what is the best type of strokes or ways that we can go down that part of the back to get to the Iliocostalis to work on that?
Yeah, I'm really torn with this line of questioning because on the one hand, I want and the world needs massage therapists like you, Mr. Blygen, who are worried about hurting your client. Like, that's a good attitude to have. Like, we want you to be careful. On the other hand, we also want you to kind of take the brakes off, right? Because we want you to kind of dive in. I can tell you, I have never known a massage therapist to break somebody's ribs. Ribs are highly flexible. If you had a very elderly client, I'd be a little more careful, but you know, I think you would be anyway. But for stuff like this, it tends to be angles too. Don't push right down on the rib. Change your angle to more like this and try to rub this way with it. I know that wasn't a brilliant insight, but my point is, I might dig in straight or close to your spine because there's more stuff to catch me there. When I'm out on your ribs, you're right, it does get kind of bumpy, and I might go to a flatter concept so that I'm Just rubbing those. I don't have any great moves for them in particular. I consider it part of the back, and I rub it with effleurage, deep effleurage. You're right, I don't use an elbow that far out because you'd literally be going bump on each rib, ba-bump, 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 ba-bump. And that does sound like that would be uncomfortable and just unpleasant. But I usually go with the grain, which is, superior and inferior down the back. And I just go out wider and I go flatter and I still work those. Yeah. And I will tell you, I think one of the most important parts is the tie-in down here in the thoracolumbar aponeurosis. I think when you guys get down here, you want to start going deeper and open this area up. So again, don't be too cautious down here. When you're back down in the thoracolumbar aponeurosis, get in there. That stuff is strong, really strong. Yeah. For those of you who remember when I was in your class and I was pushing into L5S1, that's right down in here. And the reason I'm able to push that hard is because of the thoracolumbar aponeurosis. But anyway, sir, regular effleurage. With intention and really feeling for it, but regular effleurage. That's my favorite stuff for that area. If you wanted to emphasize it for some reason, and you really wanted to hit the iliocostalis, we know that unilaterally it likes to flex. And it's out of the sides. So it's going to be a major lateral flexor because it's out of the sides. You could take somebody's body on the table, I've done stuff like this before, and put them into a lateral flexion. I'm not talking about them sidelining, I'm talking about them laying face down, and you take their legs or their upper body and make them laterally flex, and then you work this other side that's now in a stretch and do your effleurage on that. And that will turbocharge your massage on that side of the spinal erector. And that's always a good way to kind of ramp up your game. If you feel like you need to go deeper or you need more therapeutic effect on an area and you're not worried about hurting them, like they're not a terribly sensitive client. This does not work with a sensitive client. But if you think that they need more work, you want to get more out of it, you want to get more stretch, you want to turbocharge your massage, you want to get more aggressive, put it in a stretch and massage it. Any muscle. Very effective. The only reason I don't do it is sometimes it's more painful. And so if I have a client who's kind of like, that's plenty, I'm not about to put them in a stretch and then work it more. That's too much for him. Yeah. Cool. Cool. Awesome. All right. So the spinalis grabs onto spinous processes. The iliocostalis grabs onto all your ribs, costals, and your transverse processes. Right? Of the cervical and the lumbar, because it swings out to grab the ribs, comes back into the lumbar, swings out to grab the ribs, comes back in to grab cervical. In between these two is the longosimus. Yep. And the longosimus, maybe I need different colored tape, but the longosimus goes from the mastoid process. I'm going to run out of tape. I just ran out of tape. Try something different. Goes from the mastoid process to the temporal bone, transverse processes up there, all the way down. Grabs onto some ribs on the way down and goes all the way down to thoracolumbar aponeurosis. And it does grab onto some ribs, I get that. And I know it doesn't have the word rib in it, but it doesn't grab onto all the ribs. Grabs onto some of them. So it comes here, grabs onto some transverse process, grabs onto some. And so the way I want you to kind of remember them in your head is spinalis is on both sides of the spinous process, is grabbing onto them all the way from the top to the bottom, right? Longosimus is even higher up. It grabs on the mastoid process, grabs onto some transverse processes, some ribs, and goes all the way down to thoracolumbar aponeurosis. Iliocostalis grabs onto some transverse processes, sweeps out, gets all the ribs, and comes back in to the lumbar transverse processes again. Terminates in the thoracolumbar aponeurosis. How important is the thoracolumbar aponeurosis to your overall structure, the architecture of your body? On a scale of 1 to 10, it's a 14. All right? It's super important. The thoracolumbar aponeurosis is where all three of your spinal erectors insert, right? But we saw your latissimus dorsi inserts in there. We saw your glutes come up and grab onto it down there, and we're just getting started. It's massive. It's there designed to support your low back. and to allow lots of different stuff. Remember, it's just a big sheet-like tendon. Tough, tough, tough stuff. Okay? So, I want to show you this slide because I just thought it gave an easier way. I know it's not like, oh, the light is shining now and everything's easy, but an easier way to kind of digest all these origins and insertions. And again, I could care less about origin and insertion. You can't really say whether my thumb is getting closer to my finger or my finger is getting closer to my thumb. The fact is they are just both attachments and they get closer when the muscle contracts. And so, in a back bend, I guess you would argue that my upper body normally goes to my lower body, but not always. Not always. So they are attachments. Cool. And these are the heavy lifters for your back. Cool. And these are probably the muscles you're going to work on more than any muscle in people's bodies just because they run right down their spine. And it is the spinalis and longosimus that tend to give people the sunken spine look. I don't know if anybody in your class has it. It is a compliment if you have it because you have it, not because your spine is sunk. Spines can't sink. Nobody in this class has a sunken spine. What you have is very well-developed spinal erectors. And when you build up two hills on both sides, it looks like you have a valley. And so when you have very well-developed longosimus and spinalis, it makes it look like your spine is sunken in because the sides of your back are really built up. Look at a bodybuilder sometimes. Sometimes it looks like it's like a cavern in there going down. It's because their spinal erectors have gotten so large. Yeah. And you can see that on some people, if they're very slender, you can see their iliocostalis too. You can actually see these muscles rippling through their skin if you know what to look for. You can kind of see the iliocostalis kind of going out like this and the other one's running up and down like that. So look for that and feel for that on your lab partners. They don't have to be slender for you to feel for it. But I've been in some of your labs where I've seen it in some of your backs where I'm like, oh, that's an iliocostalis. All right, cool. Questions? Obviously, these muscles get tired a lot, and so just general massage, I would rub them on people, right? They're tired of holding their bodies up and things like that, things of that nature. Okay. All right, so let's go back. I know we're hopping around a little bit, but what I want to try to do is bring, that's all we had to talk about today, is these three muscles, right? But that said, I was hoping that we could take a quick break, maybe a long break, maybe 15 minutes, but then come back and let's talk about all the other muscles that we're going to be talking about later in your next class after spring break that are in the back that are going to kind of go along with spinal erectors so that it's not the first time you've heard of them. Does that make sense? So we've got a lot of other fun muscles that are back here, and this will not be for a test today. It's just to give you some stuff to kind of like, oh yeah, Tapscott talked about that. I kind of know where it is because we kind of talked about it and things like that. So let's take a 15-minute break. So let's look at the back in a little bit more intimate detail. Boom. All right. So let me show you some pictures here. Bear with me. Okay. All right. Let me see if I got more on this too. Okay. Good. All right. So let's talk about muscle groups. I'm going to talk about 5 muscle groups from the back. I want to reassure all of you. I hope this doesn't make you tune out. I hope it makes you tune in, but I also like to be very transparent with you. I admit that everything I'm about to talk about now, I will say again in about a week and a half. So it's not like you have to hang on every single word. However, I think it'll help your brain organize stuff. So we just talked about these big long muscles running down the back. These erector spinae muscles, right? And they spinal erector muscles, erector spinae muscles, they keep your spine erect. And they both essentially grab onto both sides of the spine. They grab onto the spinous processes, transverse processes, ribs, and they all insert down into the thoracolumbar aponeurosis. And they help you do extensions and lateral flexions depending on how they're working. Okay? All right. If we tore these off, as it is our habit to do, there are some really neat muscles that you will find underneath them. They're called the Transverso Spinalis group. because they run from transverse processes, the transversospinalis group, really. But don't worry about that. Worry about this. There are two muscles that are found underneath these guys, these Erector Spinae muscles, that are kind of the shoelaces for your back. And that is the multifidi and rotatories. The correct pronunciation is multifidi. Multifidi, sorry. This is all... Multifidi is the correct pronunciation. The reason I have such a hard time with this is because I'm a high school student once who goes, that sounds like multifidi. And so we all started saying multifidi because it sounded like 50 cent. And that was really cool for a whole year of high school. And now I can no longer say them correctly. But it's multifidi and rotatories. Anyway, what's cool about both these muscles, they look identical. We will talk later about how to discern between the two of them. But they're little, tiny little cross like little shoelace-like muscles that essentially go from your spinous process of one vertebrae to the spinous process of another one a couple down. And there are a whole bunch of them, and they really do look like shoelaces of your back. So while you've got these large spinal erectors coming up and down, you've got these multifidi and rotatories shoelacing and tying each vertebrae to the next vertebrae until several vertebrae down. And so we will later learn about those, and it makes a lot of sense. You've got these powerful spinal erectors, the spinalis, the longosimus, iliocostalis, pulling on the back, right? But the back is still a stack of dominoes. It's still a stack of dominoes, and we need to lace all those dominoes together too. So the rotatories and multifidi shoelace together and actually tie together like shoelaces, like lace, all the way down your vertebrae and help give extra stability to them. And they too, by the way, can help with rotations and extensions, all that good stuff. But they are underneath those. You've also got another muscle that they throw in there called the Semi-Spinalis Capitis. And that is this muscle that kind of runs up just part of your spine up to your head. And the significance of the Semi-Spinalis Capitis is that you can see evidence of this muscle. You can't actually see this muscle. You see evidence of it on everybody. The Semi-Spinalis Capitis is what creates the two speed bumps you see on the back of everybody's neck. You know how it looks like you see two little ropes kind of on the back of everybody's neck? Well, their traps are over that. But underneath their traps is this Semi-Spinalis Capitis, and it creates, they push out in a way that creates these kind of two like ropes down people's necks, and those are the two speed bumps of their back. And so you're not actually seeing the Semi-Spinalis Capitis, but you're seeing it push up on the trapezius. So, if we tear off the trapezius, and quite a bit of other things, by the way, and the rhomboids, you will eventually see the Erector Spinae group, the Spinalis, Longosimus, Iliocostalis. If we tear those off, you will start to see these shoelaces, the multifidi and the rotatories, all the way down. And this Semi-Spinalis Capitis, which is these two little speed bumps up there by the neck. Sometimes I've come by and touched some of you. I think Mr. Placencia, I was probably doing this today without thinking about it, but I was actually pushing your spinalis away, sir, and getting into your rotatories and multifidi.
Yeah, that was good. I like that.
Cool. So what I was actually doing is pushing the long muscle away and getting very deep into your thing. I was kind of pushing the long muscle away and getting very deep into here, into where your multifidi and rotatories exist. And I love that kind of work in there, that kind of detailed work in there. So they are palpatable, they can be found, and it's a whole other layer of back thinking. So when I'm doing effleurage down your back, I'm thinking spinalis and longosimus and iliocostalis. When I start pulling those apart and getting down into your vertebrae, I'm thinking multifidi and rotatories. I'm actually going down another layer. Cool? Then, there are some other muscles too that we will learn about that are in the back. Some are up in the neck, and that's your splenic muscles, and you've got a Splenius Capitis and Splenius cervicis, which are muscles that, by the way, kind of attach your head to your spine up in here, and we'll learn about those later too. Don't worry about it. This is just preview of coming attractions. I just want you to have heard about this stuff before. If we tear all that away, and I mean all that away, we get down to these 8 adorable, 4 on each side, these 8 adorable muscles that fill up this much space in the back of my neck, right here. 8 muscles in this space, right there, and they are called the suboccipitals. And they tie your head to C1 and C2. The suboccipitals tie your head to C1 and C2. And they're important. And here's why they're important. They're tiny. For some reason, most therapists overlook them. I'm not quite sure why. On some clients, they're very sensitive. Most people enjoy having them worked on, but not everybody. And they are definitely a major headache area to work. And they have a lot to do with how my head articulates on C1 and C2. But they also have a lot to do with tension right in the back of my head where there are nerves coming out. There are cranial nerves that come out right underneath my head, right by C1 and C2, that then wrap around and feed the rest of my face and all sorts of important stuff, and they're back here. And this area back here gets really tight. And so, to Mr. Blygen's point, I not only rub that area really hard, but I actually articulate the head. Right? I'm actually moving my client's head around to try to get my finger in there further and really work that area and really get into the suboccipitals. I spend a lot of time on suboccipitals, assuming you can take it. And you will leave some people sore. You will not do any damage at all. And people that are migraine sufferers, you can go ahead and take this and you can just beat the back of their suboccipitals like this and they will give you a $100 tip. They love it. I would never beat anybody, but my point is you could literally take something like this and you could just, and they love it. They're migraine sufferers and they've got all this tension back there and they're going to thank you for it. I've actually had migraine sufferers push back on my fingers as I'm pushing into their head, push back on my fingers until my fingers hurt because I wasn't pushing hard enough. So they love it. Anyway, suboccipitals. So we tore off the spinal erector, spinalis, longosimus, iliocostalis. We found these like multifidi and rotatories under here and all this other speed bumps and spleeny stuff, forget about that. But we dug underneath all that, and then we got down to these 4 little adorable muscles that take up just this much space right here. Just this much space. Right here. 4 on each side. Rectus capitis posterior major and minor. Oblique capitis superior and inferior. The names don't really matter. They're the suboccipitals, and you will hear people talk about the suboccipitals. And I always make this joke to my clients because they go, wow, it's really sore back there, but it feels really relieving. Why are you doing that? And I'll go, well, basically your head is screwed on a little too tight. But I say that joke because they get it. I really mean it. Like, in a way, your head is screwed on too tight. That's why I'm working on that area. You are too compressed between your skull and C1 and C2. And we want to create space in there. And I'm actually thinking about that. I'm not just rubbing you in here. I'm trying to pry my finger in between your skull and C1. I don't think this can be done, but I've been trying it for 26 years. And one day I will do it, maybe with one of you. I'm trying to pry my finger there to create space in there. I would like to pull your head off if I could. I want to get in there. So I'm not only not being timid, I am digging my way into your brain. Make sure that you open up the suboccipitals. And lastly, we'll be learning about a group of muscles that I'm not sure I've ever really felt. And those are the inner process groups. And it means the groups that connect between your processes. So between these spinous processes, there's a little muscle down in here. And between these transverse processes, there's a little muscle down in here, tying them all together. The reason I don't think I've ever felt them is to get down to this layer. There's ligaments in the way. I had to remove spinal erectors. I had to get past the multifidi and rotatories. There's still ligaments down here and all sorts of important stuff. And by the way, you have ligaments that tie your entire spine together. It's not like there's just muscles doing this. And then I'd have to get between these little spots, and I don't know that it can be done, to be honest with you. But those are called your inner processes group. A lot of people don't even call it that. I think I might have made that up. But it's your inner transversary and your inner spinalis. And all that means is your inner between the transverse processes and your inner between the spinous processes. Teeny little muscles. Teeny little muscles. I don't ever really talk about them very much because I'm not sure I can get down to them. But they, again, are trying to tie your vertebrae together so that you can get this wobbly domino, 24 domino thing to stand upright and be erect. Because it's tricky. And that's just what's happening on the back side. We got stuff happening on the front side to try to keep you erect too, right? But that's what's happening on the back side. So this slide here that I've just realized I am not presenting, am I? Which would really help you. It's a good thing spring break's coming up, huh? This slide right here is a good overlay of major back muscles that we're going to be talking about as we come up. Okay? So, again, we start out with the Erector Spinae group. This is the last thing we're learning about. I said if you tear that group off and you go deeper, you get to the multifidi and the rotatories, what are like the shoelaces of your back. If you rip those off and get really behind the head, really, really deep, you get to the suboccipitals. The inner processes group is the inner transversary and the inner spinalis. Those are really tiny, and they're so deep that they're behind stuff, like between little teeny processes in here, and I'm not sure they can be gotten to. I'm sure people tear them all the time, like in whiplash and stuff, but I don't know that we can actually reach them. That doesn't mean that massage in that area doesn't help them. Yeah. So those are some of the highlights of coming attractions that we're going to talk about as we get deeper. You don't know what you don't know, but do you have any questions? Yeah. Yes, Ms. McDowell.
It's kind of a little bit off topic, but you know, there's like the saying like lift with your knees, not with your back. I mean, if your back is really so strong, why shouldn't you lift with your back?
Yeah.
I mean, I know you're not supposed to because it hurts, but I mean, if it's so strong, I don't understand like what the issue is.
Yeah, so you make a really, really good point. And there's a little bit of debate on this, but I love piping up about stuff I know very little about. So, lifting with your back is actually not a problem. The problem is when you get tired. All right, so the problem with most lifting exercises or things that you have to do is not really whether you're in proper ergonomic form or whatever. You can lift stuff improperly all the time. What happens is when you get tired and your muscles stop doing the lifting and your ligaments have to take over. So when I bend over improperly and kind of hunch my back and lift something up, that's actually not a big deal. You're absolutely right. My spinalis, longosimus, iliocostalis, not to mention my quadratus lumborum and all the multifidi and rotatories kick in, and they are powerful. And this is why people can deadlift 1,000 pounds. There are people out there that can do this, right? So obviously it's fine. What happens is this, and this is very common not just to people, but weightlifters and people in offices and everything like that, is when I get tired is when problems start to happen. So when I'm lifting improperly like this, my muscles are still giving me form and carrying my back. What happens is, let me just use my wrist as an example, all right? Right now my wrist is bent over, but my extensors are holding it a little bit. It's not bent over all the way. They're holding it. And so if I put pressure on it, I know we always tell you, be in neutral when you're doing massage, be in neutral when you're, but this isn't a problem right now because I still have strength here holding it. Well, when I get tired back here and the muscles poop out, my wrist doesn't fall off, right? Because my ligaments still hold my hand on. But now it's just ligaments holding my hand. And ligaments are good at that. They attach bone to bone and they work for a while. But that's when problems start happening, is now you are pulling on ligaments. Ligaments weren't designed to be pulled on all the time, and now you're bending this joint or your back or whatever it is, right, in this funky manner, and that's where the problems arise because now the person is relying on their soft tissue, their ligaments, to kind of keep it all together, and they weren't designed really to do that. And you can get away with it for a little while, but that's where the problem comes in. We actually don't find that the problem is from the poor posture or the lifting itself. The problem is when your guys' muscles give out other stuff kicks in. So we see this even at a desk job, right? I'm sitting at a desk job. It's okay. I'm hunched over looking at your guys' grades, doing your stuff. This is fine for a while. But eventually my neck muscles get tired and they start to slouch. And then my ligament nuchae has to take over. And then my body goes, oh my God, we don't really have any muscle strength here. And this guy wants to stay here for 40 hours a week for 40 years. And it starts building up extra fascia there to hold up my head. And I start developing other problems. But so it's when your muscles tire that the problems occur. Same thing is true even with your feet. Your feet are designed to actually go smush, smush, smush and have the spring to it. And a lot of that spring comes from muscles. Well, when the muscles get too tired because you're running all the time or hiking all the time, then the ligaments take over for a while. They've got some spring, but eventually they get pretty tired too. And that's where the overuse injury kicks in. So I hope that answered your question. But it's,
Yeah, that was helpful.
yeah. So it's the lack of support that causes the problem. It's not the posture. Yeah.
So, like, if you were, like, bending down to, like, pick up, like, a moving box, you'd be using your quadricep muscles. Like, if you're, like, bending down, like, squatting your knees, you'd be using those muscles to lift rather than the ones in your back.
Yeah. I mean, you're still going to use your back muscles. There is no way to uninvolve them. And they are right, by the way. I mean, here's why they don't want you to bend over using your back, because it's actually much harder for me to be way extended here and lift something. It's much easier if I lift it with my legs. And when I bend my back way over, I'm kind of doing that. I'm way out here, I'm putting all the weight forward, and that's actually very hard on my back. But if it's strong, I can do it. But it's better to keep everything over my center of gravity and my legs do it. That's what they're designed to do. So it is better not to bend your back. But it's not the bending in and of itself that causes problems. It's if I'm a stalker and I do this all day long, now my back's getting tired. Now what I start to do is bounce off my ligaments. I'm not really using my spinal muscles. I'm just kind of bouncing. And that's where they start to have the problems in my back. Yeah. But it is better form to not bend way over and all that kind of stuff. You use your muscles better. But again, that's not the problem. The problem is overuse, your support system goes away, your ligaments have to kick in, and eventually they give way. And your joints too. Your joints take more wear and tear when you're tired because your muscles are giving you this kind of springiness and making sure stuff doesn't lock together and all that kind of, when that gets tired, stuff starts to bang together and things like that. Yeah? Cool. Good. Any other back questions? No? No. All right, let's see. Would you guys like a copy of this slide, by the way? Maybe? Yeah, it kind of just makes sense. Let's see if I can do that right now, even. Thought I'll find out here. Oh, wow. All right. All right, I will make a copy of this and get it into your stuff today. Let's see about your homework, though, too, while I'm doing that. I don't think you have a terrible amount at all. If you are wondering what we're going to be doing the next 2 days, it'll be review. We will review systems of the body tomorrow, which we've only done 3. Tegumentary system, skeletal system, muscular system, I believe. Skin, bones, muscle, that makes sense. And the muscles we've done so far from chapters 1 and 2, and the introduction. So we'll do directional terms, all sorts of stuff. Let's see. Boom. You've got just 14 questions to answer about spinal erectors, and I believe another discussion, and that's it. I will look up the discussion here. And you can start now, and I will look at getting you this copy here too, as we speak here. Okay, so you have this short quiz and you have another discussion, one of those TED Talk discussions. And let me just warn everybody ahead of time. It's going to assign you a partner this time. That's great. Yay! It's going to tell you you're late on the assignment because it's the only way to tell it to start assigning partners. Do not worry. Nobody's points are getting deducted. Nothing's happening. Just turn in the assignment late. But if I don't tell it the assignment's due, it won't assign you partners. So you've got two things. You've got a quiz here on the Erector Spinae group, and you've got something called one of the most eye-opening motivational speeches ever. That's what it's called. And I'm going to go either find copies of these slides for you guys on the backs of the muscles, or I'm going to create them right now and put them into the lecture, and I'll let you know where I put them. But it'll be in today's lecture, if it's not already there. I don't think it is, though. Seven.